Hi, my name is Whitney Theory, and today I'm going to talk to you about oral contraceptives and the controversy that goes along with them and whether or not women should or should not be allowed to take them. So, for many years, people have been debating the issue of whether or not women should be allowed to take oral contraceptives or birth control pills, as they're more commonly known. There have been statements made by people that women shouldn't be allowed to take them at all, and then there's been statements made that only unmarried women should be unable to take them. But interestingly enough, nobody's really stopped to think about the other things that women can use them for and all of the possible pros that taking oral contraceptives can have. Over time, it's been found that women can take them obviously to prevent pregnancy, but also to prevent bone density loss, as well as preventing or helping with ovarian cysts and preventing and treating acne as well. Of course, like any other issue, there are cons to this as well, but in this specific circumstance, I really believe that the pros for taking oral contraceptives far outweigh the cons that they might have. Some women don't want to have children, and that is every woman's choice in this world. Some women don't want to have children just because they don't feel like they should, and some women may have greater reasons, like because of a disease or a virus that they might have. For instance, there is this disease called Huntington's disease that is an absolutely horrible disease, and it starts affecting women usually around the age of about 30, and women don't usually live much past the age of 50 with this disease. It breaks down your mind, it breaks down your body, you have no control of yourself, and a lot of women don't want to have children who have this just from the aspect of raising them, and they're going to be unable to raise their children, but also because this is a genetically inherited disease and it's got a 50% rate of being passed on to your children. So if they did have a child, that child would have a 1 in 2 chance of getting this disease. And if the woman had 2 children, then more than likely at least one, if not both of those children would have this disease. There are also other things like HIV, people who are HIV positive. There are chances that it can be passed on to a baby, and some women just don't feel like they should take that chance, and that is their choice. But there are also other reasons that women take oral contraceptives. It's been shown that the long-term use of taking these pills can actually help prevent bone density loss. You hear all the time about how much women suffer from osteoporosis, and that is something that is so painful to so many women, and taking these pills can actually help with that. So, obviously there are risks to taking it long term, but some people, it's people's choice of whether they want to take those risks or not. It also helps regulate your menstrual cycles, which can help with things like follicular cysts, which many women all over get these. They're cysts that form in your ovaries, and they pass with each menstrual cycle, but in turn it just makes a woman's menstrual cycle that much more painful, which for every woman out there, you know how much pain a menstrual cycle can be as it is. So birth control pills or oral contraceptives can help regulate your cycles, and it really just helps decrease the pain of these follicular cysts. But there are other types of ovarian cysts caused as well. For women who have endometriosis, a side effect of that is that you develop something called endometriomas, which are ovarian cysts, and they can be extremely painful, and oral contraceptives do help to remove the cysts from your body and break them down. So that will help with their pain as well. One of the most widely recognized things that birth control is used for, aside from pregnancy prevention, however, is acne treatment. dermatologists all over the world use birth control as an acne treatment. Some people have acne that just isn't treated by, topical treatments like Retin-A and other creams like that. So when those don't work, a lot of doctors turn to birth control pills for girls anyways, because it does control your hormones, and many people suffer from acne in the puberty stage of their life when their hormones are out of balance and out of whack. And so overall, the oral contraceptives will help regulate these hormone levels, which will help treat and reduce the acne that people suffer from. There are also people who opt to take something called Accutane, which you actually, when you are on it, you have to take birth control or oral contraceptives, because if you were to get pregnant while on Accutane, the birth defects to your baby are catastrophic. So they will actually make you take birth control if you are on Accutane for acne treatment. So these are just a few reasons why women should be allowed to take birth control or oral contraceptives without being ridiculed by people. And there have been current debates about whether or not insurance should cover these pills, and it most definitely should. This is something that every woman in this world has a right to be able to take, and they should be allowed to take it without any complications.